instrument assisted soft tissue mobilization. See, while I'm talking about the ISTM, if you want to ask any questions, though, you can write down in the chat section. So keep remind me about the questions, girlfriend. So maybe I'm not leaving any
Yes,
comments or any questions are there.
I'll try to pen down also if we miss something, so that we will
Yep.
answer them in the last thing.
Hi, Gustavo. Hi. Good evening, Gustavo. It might be it's morning in Brazil, but here in India it's evening. So one of my close friends from Brazil just joined the our session.
Yeah,
We
you
had
have
a
been to Brazil in this year.
we, yeah, we have wonderful time in Brazil regarding the ISTM.
Yeah,
He is a
Neurological.
magician.
Yeah.
He is magician. So today I'm going to talk about the instrument assisted soft tissue mobilization, like different concept of ISTM. How the ISTM will work for the what I can say in the chronic tendinitis. How ISTM will work for muscle spasm. How you can use it for muscle activation. So there are so many aspects that you can use in ISTMs. See, instrument assisted soft tissue mobilization. It's a concept of just soft tissue mobilization, or you can say the release. The words of mobilization and release both are different, but people are using as the same. ISTM, a concept of release, and concept of mobilization. The thing of mobilization means we want to mobilize something. When we found some adhesion, like in between the two muscles or maybe between the fascial adhesion, if we call it the fascial adhesion, when muscle having the outer covering of is called as a fascia. When there is some issue between fascia and muscle, you can call it a fascial adhesion. That fascial adhesion creates more load on your muscle. So muscle, if you want to perform like go for muscle contraction, then muscle need to go for more power. So when you're asking for more power, it means you are intensely giving some what I can say tension on the tendon, and your tendon also will be in the some tense conditions, which is not good for, which is not normal. So we just try to release that facial adhesion to just try to mobilize that facial adhesion to do some what I can say free motion and for the some easy motion. Right.
Yes.
So if any questions, meanwhile, then you can ask me.
So, sir, as this technique of ISTM, is it like based in the neuro part or musculoskeletal or sports, or you can use it anywhere? Like,
Yeah, you
how
can
it?
use it anywhere.
Yeah.
You can use it anywhere, but more or less it's useful for in the ortho conditions. See, I am a practitioner for the orthopedics and pain, so I'm concerned about the neurological aspects. But what I learned in my bachelor's and master's about the theories of neurology, we can use this tool to give some stimulus. See, our body, whatever we feel in our body, it's because of the receptors which we have in our body. If you're listening me, it's because of receptors. I can, if I'm speaking, it's because of receptors. If I'm seeing you, it's because of receptors. If I can feel the air, it's hot and cold, it's because of receptors. So when you're going to touch your body receptors going to be activated, and your brain will be give some signals in response to the activation of receptors. So
Yes.
ISTM also work on the stimulation of receptors. So you can use in any conditions like orthopedics, neurology, it's up to you. But the basic concept is just about to stimulate the mechanoreceptors in the ISTM.
Okay. So, sir, Rutuja is asking us, sir, how does the soft tissue relieve pain?
Oh, see, what do you mean by pain? Pain is the emotional response of the body when the person having some, what I can say, some spasm or something is there which is not normal. That time a person can feel the pain. That for pain, you can use the ISTM. Just take an example. This is a fascia, and this is your muscle. If your muscle want to glide, then muscle can glide very easily. But if some addition, then you stuck here, then it's very difficult for your muscle to slide under the fascia. So that time you can feel some pain because facial also having some neural structure and the neo and between the fascia, if having some adhesion, then this adhesion creates some pain. So when you're going to mobilize that adhesion, the pain going to decrease.
So, sir, why is this the different shapes of this ISTM tools? Why is this for?
Different tools.
Yeah, different shapes of these tools of ISTM.
Different shape of the tool depends on the body area and depends on the convexity and concavity of body. Like if I'm talking about my forearm, then this area is a convex, so it must be fitted with the concave area of tool, so I can get the better advantage. I can get the maximum contact with the skin with the use of this concave area. See, in the ISTM theory, once you have a maximum contact with the skin, you can give some maximum stimulation. That's why we have different edges and different curves on in the tool.
Okay. So Kapoor Anshu is asking, is this technique indicated for post-operative contractures or spasm?
For spasm, you can use it. For contracture itself, kind of fibrosis, it is not really treated. Fibrosis itself is a reversible condition. For fibrosis, I'm not suggesting. For spasm, you can use it. For spasm, you need to roll this tool on the muscle belly. So during that, you need to go very slowly and just try to apply the tool on the muscle belly, which will help you to release the spasm. See, in this spasm, we have different goal. In this spasm, we just want to release the muscle. So there is no mattering about the different shapes and edges. You just must need to go very slowly. Like, take example, I have spasm on this side. So I'm using this, just try to apply and go very slowly with a normal pressure. No need to apply more pressure on that.
So, sir, Nupur is asking what material is it and reason for it.
Oh, different materials are available. Like what I have, it's stainless steel. Sometimes people are using plastic materials, and different materials are available. But it depends on the or your use. What you want to use for ISTM. See, I love stainless steel, and that Gustavo love that different kind of tool. Like Gustavo theories and techniques are a little bit different than stainless steel. If I'm using the stainless steel instruments, then might be I'm creating the more fibrosis. I'm just going to what I can say, I hurt the muscle unintentionally. That's why for the muscle spasm release, he want to go with the that lightweighted tool, which is a finer in edges.
Okay, sir. So sports HPE is asking us where are adhesion formed in fascia?
It's just between the fascia and muscle. Okay. Not on fascia, but between the fascia and muscle, the adhesion will be formed.
Okay, so someone is asking is why while using ISTM tool, hello?
I read that. Yeah, direction of application depends on your scaling. Like first, start with the scaling. If I'm going to start from distal to proximal, and in the same direction, if I am going to find any scar, then I'm going to treat in the same direction. So, direction of strokes depends on your scaling techniques that you can use.
Okay. So, yeah. Sir, Kapadia Sabnam is asking us, can be used in post-operative stiffness and how it improves the range of motion.
Yeah. See, whenever there is an issue with the soft tissue, that time you can use this ISTM. So whether it be pre or post, it doesn't matter. But whenever you feel there is an involvement of soft tissue, you can use this ISTM.
Okay. So, sir, please let me know subscapularis release application.
Subscapularis muscle. Yeah, it's very difficult for me to perform in this video. Yeah. But in my workshops and in classes, I already explained about this. For that, you need to keep the hand look like this. Then you can approach from the supine line. You can also approach from the side line. Whatever available range, if you have in the patient with the frozen shoulder, that you can approach. From this area, I'm just talking about the axillary portion. It's very easy to approach your subscapularis muscle. Normally, I'm telling that subscapularis is a key muscle for the frozen shoulder. Yeah, you can. It's very easy to use, and you can use it as a, what I can say, ISTM, which movement you need to apply the tool over there and go for internal and external rotation. It will use the muscle very easy.
Right, sir. Sir, any uses of stainless steel?
Any uses of stainless steel? Yeah, stainless steel instruments will give you some resonance. If I'm going to roll my tool on the skin, it will help you to find out the soft tissue abnormality. If I'm comparing with the plastics, then plastic will not give me that resonance, so I cannot feel that vibrations if something is abnormal. So I love stainless steel to just try to find out the soft tissue abnormality. And one of the beauty of this stainless steel tool you can use in a chronic tendinopathy. In that, you need to just go for the reintroducing inflammation. For the process of reintroducing inflammation, you need to use the sharp edge of ISTM, stainless steel tool. Then just try to create some controlled microtrauma around that tendon. Then it will help your chronic tendinitis, tendinopathy, to try to become acute and try to become an acute stage and try to complete that process of inflammation. That's why I love stainless steel, and it's a little bit heavier, so no need to I apply more pressure if I want to go very deeply. Still, if I am in a plastic material, then I need to apply more pressure and go very deeply. Normally, plastic ISTM tool is not available, but what you're feeling in the plastic, it's just guasha therapy. Whatever available in markets, it's a guasha tool.
So, sir, someone is asking us what are the types of strokes?
Structures, I love to go with the pin and stretch. Then ISTM stroke with the movements. That there are numbers of strokes for that, but basic strokes: sweeping, fanning, scrubbing, brushing. These all are the basic strokes that you can use in the routine practice of ISTM. Once you're familiar with the grips, once you're familiar with the pressure, then you can use different techniques of ISTM, like ISTM with movement, ISTM with the and ISTM with the some static exercises. That you can use it. Yeah.
So, sir, you have gifted Gustavo sir some instrument of ISTM. What was that?
Huh. It's a different kind of material. It's a lighting weight. So normally they're using it to remove the adhesion between the bone. If I'm talking about the tibialis anterior, then if I'm putting this tool between the tibia and the tibialis anterior muscle, then it's a little bit hurty. But if I'm using that Gustavo tool, then it's very easy. I can put very easily. If I want to divide two muscle, like from, if I want to create some space between the trapezius and the supraspinatus, then also it's very easy. Just go inside and try to roll the trapezius on upside. With ISTM, like stainless steel tool, it's a little bit difficult.
So, sir, do you produce all these instruments of ISTM?
Yeah, we have our own manufacturing concept. That manufacturer guy also might be online. It's a Dilip Goyal is there, so he is helping me for manufacturing of this all the tools.
Great. So, sir, Samiksha is asking us, does it give some rashes after treatment?
See, normally there is no rashes because this is not a guasha therapy. It's an instrument-assisted soft tissue mobilization. See, there is a huge misconception between the guasha and ISTM. People feel in ISTM we just try to create some redness on the skin. It's not about redness. If you are creating the redness on the skin, it means you are producing the inflammation. See, if inflammation process is going on, it will end up with the scar formation. So जो आप निकालना चाहते हो जानबूझ के आप दे रहे हो. That's why I'm not suggesting for the redness. It's about to feel some myofascial adhesions and the scarring. Then you need to release that scar. Like that's why I love this stainless steel to try to find out the soft tissue abnormalities.
Okay, sir, what are the contraindications of ISTM?
Contraindications, yeah. For contraindication, the skin condition is literally absolutely contraindicated. Then few vascular conditions like phlebitis, thrombophlebitis, and the varicose vein. These all conditions are absolute contraindicated because I don't know what's happening inside the muscle or inside the body when I'm rolling the tool on the skin. So that's why it's a absolute contraindication. More or less, everything is indicated, but two things are contraindicated.
So, sir, can you tell us? So, sir, can you tell us something more about fascia? People are asking something about fascia.
Fascia,
Yes.
fascia itself a big task for me. Fascia, what I can say, it's a very emotional structure. If you're going to just like this, then also you can activate the fascia, you can release the fascia. The term may having a different concept over there. It's a called as anatomic train, and the Institute of Stecco in Italy, they are working on the fascia manipulation. So for me, it's difficult to answer about the fascia because didn't adopt
It's a
what I get
vast.
training of fascia. I'm supposed to go for the training of the fascia in this June and July, but unfortunately, this corona stopped me to go to the Italy.
Yeah. So, sir, in cancer, is it contraindicated?
Yeah, definitely, it's contraindicated. Some
Okay.
pathological condition, it's contraindicated. It's like muscle pathologies like muscular dystrophy. It's also contraindicated.
How does use of ISTM help in trapezitis? How does use of
Trapezius,
helps
huh?
in trapezitis?
For any muscle, like for any spasm, you just want to focus on the muscle belly. You need to just go very slow stroke on the muscle belly. It will help you to release the spasm. Like what we are doing in the myofascial release, like if I'm using my hand and go very slow, just this instrument using instead of my hand, just try to roll very slowly on the muscle.
Okay. And sir,
How- Yes, yes.
indications for ISTM.
Whenever there is a involvement of soft tissue, everything is in but just make sure about the some absolute contraindication that keep in mind you can use it.
So, sir, does someone is asking us that does it show better results than Maitland?
Maitland. Oh, Maitland. I don't know much about the Maitlands, but whatever I know about the Maitland, it's a joint mobilization techniques. See, it's a good debate for me to explain. See, whatever happening inside the joint, it's because of soft tissue. If you feel you have movements, it's because of soft tissue. If you feel there is restriction of movement, it's because of soft tissue. If you feel it's a stiff area, it's because of soft tissue. So whatever thing inside happening inside your movements, it's because of soft tissue. So it's must. I don't know about the joints, joint mobilization, but you can use it. But the question is, joint, your bone never move alone. It's because of soft tissue, it's going to move.
So, sir, the relief that we get after ISTM, is it temporary or permanent?
Huh. It's never able to be permanent. While using your muscle or while using your body, it's going to be damage your muscle, and every day the scar going to be formed. But you need to mobilize it. Nothing like permanent. Like your just take example of your teeth. Why you just brushing your teeth every day? Because you want to make it healthy. That's the same story in this ISTM. For make your healthy muscle, make your healthy movements. You need to use it.
So, sir, Jay is asking us why should we use Vaseline and not oil?
Yeah, oil having the good properties that you can use for what I can say myofascial release, but issue with the when I apply the oil on the skin with the use of my this hand, after that it will create some issue for my gripping of the tool. That's why I'm not suggesting oil. That's why I love to go with the Vaseline, which will give you some moisturizing also, and also it's allow you to create some friction.
So, sir, two, three questions we have got related to frozen shoulder,
Yeah.
ISTM frozen shoulder condition.
Yes, ISTM for frozen shoulder. See, in the ISTM for the frozen shoulder, you need to treat all the rotator cuffs. And also, if you want to going to approach your capsular area, then it must be ISTM with movement. You need to apply the tool on the capsular area and just go for movements of the shoulder joint. It will help you to release the deeper structures.
Okay. So, sir, what investigations we have to go through before performing this technique?
Yes, for before performing the techniques, you need to go for scanning. You need to hold the tool like this and just try to roll the tool on your body. When you feel some abnormalities, once I feel some abnormalities on this side, then I'm going to confirm with my small strokes. Then if you confirm, yeah, it's having some additions, then I'm going to roll the tool and try to remove it. Yes, we can reach the capsule with ISTM. It's very easy. We call it a pin and stretch technique that you can use for to read the capsule. Yeah, you can.
So, sir, the questions we are getting from sports HPE, you know, the instructor for sports HPE is Swapnil, sir.
Yeah,
Swapnil, yeah.
I also having a few courses from him. He's a good teacher, especially for kinesotaping and dry needling. He's a good. I'm a huge fan of him for kinesotaping. Yeah, he's a good person.
Sir, what is better, functional ISTM or normal ISTM?
I love functional ISTM as compared to the normal ISTM. Whenever we talk about the functional movements, then it will be good. Because if you want to treat any patient, see the patient complains about the functional movements. I having the pain on this movements. So just try to treat that patient according to that movement. So I love to go with functional ISTM instead of static ISTM.
So, sir, why mostly athletes go for ISTM these days? They prefer ISTM more. Why is
Yeah.
that?
Because ISTM taking very less time to treat that myofascial structures, and also it will help your therapist or your what you can say your trainer to like I can say उनको ज़्यादा force लगने की ज़रूरत नहीं पड़ेगी. It will save your energy. It will save your time. That's why we people using ISTM, and we also suggesting everyone try to use ISTM. Which one is better, joint mobilization or ISTM? See, joint and soft tissue both are interconnected. If I'm giving the answer that ISTM is good, joint mobilization good, it's wrong. Then you need to club the both things, then you can treat it.
So, sir, how many settings do we need for ISTM in
How
case of
many pages? Okay. How many sittings? It depends on your scaling. Just before the treatment, just go for scaling. Then just try to apply a treatment. After 2 days, you need to repeat the session. When you're repeating the session again, that time you go for scaling. If you feel still scar is there, then you need to apply. Otherwise, no need to apply ISTM.
Okay, so sir, your student MJ Modi is telling you that I have attended your workshop and now I am getting tremendous results.
Okay. Thank you, Modi. ISTM is working a lot. Yeah. See, ISTM, why it's working tremendously? Because we just want to treat the exact pathology, exact soft tissue issues. That's why it's become good, and we're getting good results. Can we use ISTM as a preventive method? Yeah, you can use. Yeah, you can use as a preventive method. You can use for what I can say in the sports department, if I'm talking about the injury prevention part, for the injury prevention part, you can use it. If you feel this patient having a hamstring tightness, which will create some issue during the sports matches, that time you can use as a preventive measures. Yeah.
Okay, so sir, in the month of January, you went to Brazil and you were practicing ISTM before that. So what are the
Yeah.
different things that you have learned from there?
Yeah, from Brazil, I learned the different tool. In India, we have this stainless steel tool, which is creating some issues with जिसका भी किसी ने पूछा somebody asked about the redness on the skin, so in that redness creating some soft tissue damage, and it will going to be convert and again for scar and everything. So to preventing the scar for simple muscle spasm, that Brazilian technique is very good, and few what I can say some specific movements and of ISTM that I am not able to follow with this huge tool. And if I want to mobilize some structure, it is not easy to like talking about the sternocleidomastoid mastoid, then it's very difficult. For that, we love to use these
Okay.
hooks that I learned from Brazil. So hooks, you can use it for
Okay.
finding points. You can just put your finger here and just release some specific structures, which is difficult with the design. I cannot go for with finer movements. but you can use it with hook. And with the hook, you can just try to catch and mobilize very effectively.
Okay. What are the different techniques of application?
Techniques of applications. In the universal technique of application, what I explain about the strokes,
Strokes.
padding, strumming, brushing. These all are the in universal strokes which you can learn from US, Canada, across the world. But nowadays, few manufacturers of company or few the institutes give some different name of the strokes, but things are very same. No need to worry about the different strokes. Can you explain me some technique about the nudging techniques? Yeah, you can use to mobilize the tendon. Especially, you need to perform the nudging just near about the tendon. If I'm talking about this is my tendon, I have a hook. So I'll just try to hook like this and try to pull the tendon. It's very easy. Similar patient, if I have my this ISTM tool like mobilizer in applying, I'm just trying to mobilize the tendon. Nudging is about to push something. So when you want to push the tendon, that time you use it. I'm talking
So,
about the
sir,
tendon. In the
yeah.
condition of tendinitis, you need to mobilize the tendon. For that, you can use it.
So we see those red marks on skin. What are those exactly? Is it because it is done roughly or it's normal?
It's normal. I cannot say it's done roughly, but no need to give some, no need to wait for redness. See, ISCM, it depends on your scaling. Once you scan, there's some scar, you're going to apply the strokes, and again you need to go for scan. If you feel there is no scar, then leave it. No need to go for more and more strokes over there.
What is different between argon tool and Graston tool? Do you know this, sir?
I don't know, mostly just shapes and the edges. But only the thing I know this Argon tool, it's made up in Pakistan, that I know. And Reston, it's made up in US, that I know. Rest of things, same, maybe edges, maybe thickness of tool. See, that manufacturing of tool depends on your test. What I love, जैसे कि मैं कुछ करना चाहता हूँ, I want to go with some क्या क्या बोलते हैं उसको? I will go with some single bevel edges, double bevel edges. I want to make a different shapes according to the my grips. So you can develop your own tool. It's a very easy process, not to worry about. So no need to buy some expensive ISM tools. You can manufacture by yourself also.
So people who are asking about techniques, sir will be showing it in his workshop. If you want to know the techniques, you can attend his workshop for that.
Sorry.
People asking for demonstration of techniques, but which is not possible now for you.
Oh, it's not possible. But you can check me like my Instagram account. You can check me my Facebook. You can go with my YouTube. There are like so many videos are there that you can see and in my workshops. All the participants are allowed to do some video shooting. So if you know anyone who attend my workshop, you can ask them for video.
Yes. So can you show us some different tools that you produce?
Oh, for me, this is called as a bio edges because there is in this tool we have different edges and different shapes. That's why we name as a myo edge. And the beauty of this tool, or I can say the best features of the tool, I can hold like a pencil. That's why I love this tool. And in this edges, it's a double bevel curve. Here is a single bevel curve. Here the finer edge that you can use for precise work, a double bevel. Again, on this side, it's a single bevel. And if you want to go for flat surfaces, then also we have available on flat surface. So I'm having this tool. Similar question,
Yeah.
I have myoblaster. In this
Yes.
myoblaster, convex surface, it's a single bevel. It's a concave surface. It's a double bevel. Again, this is a concave single bevel, this concave, double bevel, and we have some small finer edges that you want to do some specific work. So you can use it. And this is one round edge that also can use when you are having some issue with the tendon eminence or when you're close to the tendon, that time you can use it. So this one and two, and yeah, this is my bar. I have a long bar that you can use for larger area. You can apply a few strokes over there. And one of the best tools I bring from Singapore, when I was in Singapore, the training of ISTM, it's from MR Jeb, Mohammad Ridwan Jeb. Long name. Jeb is a good instructor. I learned so many things from Jeb. And this tool is a Polar. In India, it's very famous as a name of the Polar. Actually, the name is Polar only. I bring it from Singapore. Polar, having a good tool, having a different grips that you can apply this area. You can apply for your tendons. You can use it. And this area again, few curves and this large surface, you can go for release.
So
Alternative
sports,
of stainless steel equipments, no alternatives. You can use plastic, you can use other tools, but there is a matter of edges because ISTM techniques mainly focus on the edges of the tool, like single bevel and double bevel depends on the chronic and acute conditions. Like if I want to treat any chronic conditions, I want to at that time my indication is to create some inflammation. I want to reintroduce inflammation. For that process, I will go with the single bevel. And for acute condition like acute tendinitis, that time I just want to release the muscle belly. That time I love to go with double bevel. So this matters a lot in ISCM. So I cannot say alternative tool, but you can use your any tool. But there are some limitations with the all tools.
so
Can
sir,
club
can
with
it
the
be clubbed
MFR.
with
Yeah, you
MFR?
can club with the MFR. MFR is a myofascial release. You can club with the MFR to save your thumb, to save your hand. Good friend.
Yeah,
It's manufactured in India. Yes, sir. It's manufactured in India, in my city only, in Surat. And especially in that Surat, one of my clinic is nearby the Kamaraj town. So our manufacturing the setups it's in the Kamaraj town. So if you want to manufacture in your own tool, then you can give me some sketches. You can give me some like measurements, and I will make tool for you. You want name on the tool? That's very easy for me.
Nupur is asking from when that what is the funda behind IASTM exactly? What does it target? So
For IASTM, see, it's difficult to explain on this, but I can explain one thing. Just take an example of chronic tendinopathy. Why the condition become chronic? Because in acute phase, maybe poor healing factors or maybe continuous movements will create some load on that tendon. Then it's difficult to get the proper healing in the acute time. That's why that condition become chronic tendinopathy. For that process of chronic tendinopathy, first you need to think about the process of soft tissue healing. In the process of soft tissue healing, first point is the inflammation. See, we people hate the inflammation. People love to apply ice and love to taking the NSAIDs, non-steroidal and inflammatory drugs to avoid the inflammation. See, inflammation is a positive sign, and our body need inflammation to complete that healing process because inflammation is the first phase. It's going to convert in a second phase, repair and regeneration. In the third phase, it's called remodeling. For the process of that complete soft tissue healing, you must need having inflammation. For the chronic condition, with ISTM technique, want to reintroduce the inflammation to complete that process. This is the main concept of ISTM. This is the main goal of ISTM in chronic tendinopathy. So depends on different indication, we have different techniques.
is it
Yeah, for
contraindicated in skin graft?
if skin grafting is contraindicated because if skin grafting it's a recent surgeries and it's difficult because donor sites and receiver sites having some issue with the skin. So that's why we don't want to apply the ISCM on the skin grafting area.
Okay, sir. So I guess uh, the concept is over, sir.
Yeah, you can. The people allowed to ask. They are.
Yeah.
If you want to
What
ask any
would be
question, then
the
you can write it.
dosage of
What?
ISTM? Yeah,
What
dosage
should
of ISTM.
of STM? Yeah, dosage depends on the your scanning. Every time you need to scan, and depends on scanning, you need to create your own protocol. If I'm saying that for after 2 days again 90 strokes, 2 days again 90 strokes, for whole week after 2 days, 9 going to wrong. So if ISTM is about to create your own protocol. For protocol, you need to go for scaling. You need to feel restriction. You can treat that patient. So there is no such dosage, but average strokes is about 90, and maximum it's about 120, and minimum it's about 50 to 60 strokes. So like universal funda.
Okay. So, sir, any webinars or something that is going to come that you have planned?
No, not yet. For you are talking about ISTM techniques.
Any webinar that our users, our viewers can attend?
Oh, no, I'm a principal of one college. I forgot to introduce myself. So our college offering the webinar week. If we completed 3 lectures and maybe more threes coming. So on every day between 4 to 5 p.m. we have some Google Meet link. So you can come on that Google Meet link and you can learn the all the webinars. Tomorrow we having a topic with the pain. It's a good topic to attain. So tomorrow you can join us for webinar week. That time, why pain, how the pain will affect your soft tissue, how the pain will affect your body, why to avoid the pain, why in your physiotherapy treatment. Like in my early days, we just try to go for excessive stretches and the aggressive physiotherapy movements, like for joints to open up
Yeah.
the shoulder joint and the other techniques. But if you're giving pain to any muscle, you're going for more spasm. So you can attend with the ideas about the pain.
ISTM work can be clubbed with MFR or dry needling.
Yeah, you can club it with anything, no problem.
Okay. So, sir, I wanted to tell you as this is a live today. So, I just
Uh,
wanted today we have got a request from Pakistan. Some students are very much
ah,
interested. Yeah, some students are very much interested in setting up any webinars for them. So I just want to request you that can we work for this in future, like coming weeks?
sure. For that, students, we can. If you want me to organize a webinar for them, then I can. Anytime you can ask me. For physiotherapy
Yeah.
profession, is ready. Someone asked me how to palpate the adhesion. With ISTM tool, you need to roll the tool over there. If something is abnormal, then you can feel. Right now, it's a highway road. When you're coming over there, there is kind of a street road. Cut, 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 cut. So that kind of rubbing you can feel over there. That this way you can feel some adhesion. Make sure it's not close to the bony area or it's not close to the tendon. So this way you can palpate the adhesion. Or sometimes, like if I'm talking about the trapezius, then you need to palpate. Like patient having some trapezius spasm, then patient said, "I having a pain during my movements." That's a clear indication. So for that process, no need to palpate. For tennis elbow, if the patient has pain on the lateral epicondyle, but that time you need to treat these hand extensors. For that process, you need to go for addition of hand extensors and you need to release it.
Hi, for a patient with scoliosis with Cobb angle less than 20, would you recommend physiotherapy? This
Oh,
is
I
some
don't know. I don't know
box.
about the this scoliosis and Cobb's angle, but what I can say, scoliosis it's happened because of some soft tissue issues, so you can use it because you're not going to move anywhere without the help of soft tissue. So it must be involvement of soft tissue that you can treat with this. We can treat this spasticity in ISTM. Yes, you can treat this spasticity. If I'm talking about the spastic muscle, then you need to work on the Golgi tendon of organs that help you to decrease and increase the tone of muscle. For the process of decrease and increasing the tone of muscle, you need to go for GTO, tendon organs. That GTO it's mainly located between the muscle belly and tendon. Junction between muscle belly and tendon called as the musculo-tendinous junction. So if you're going to apply strokes over there, it's going to stimulate your GTO. That it will help you to release the spasticity. And also need to go apply the strokes on muscle belly on a slow manner, not on a fast manner, but on a slow manner, and you can treat the patient with the spasticity. Yeah, although I'm not a person of neurology, but I can answer according to the neurological principle. What difference between cupping effect
Difference
is
between cupping.
cups can pull on axial way. In ISTM, you can go in any direction except axial way. So there's a huge difference between cups and ISTM tool.
So, sir,
You can
Shrutika is asking,
cupping. You can say cupping also is a one technique of ISTM.
can we use this for post-operated ACL ligament tear?
For any patient, whenever you feel there is some involvement of soft tissue, you can use it. For ACL reconstruction patient, don't forget to release your extensor retinaculum, because numbers of time what we feel when we are focusing on the patellar mobility and the knee joint and extension issue, we just try to work on hamstring and calf and quadriceps, but we forget about the scarring which was happened during this after the surgery close to your patella. It's because of the what I can say some addition between the extensor retinaculum and your bony structures. So you need to focus on that extensor retinaculum. Yeah.
Okay, sir. I guess the questions are ended. There are no more questions, I guess. And
Okay.
sir, yeah, and everyone is thanking you, sir.
Welcome, welcome.
So, sir, this was a great topic that you took, and within a very short time, you have covered everything in this live session.
Uh,
There's a question: do we need to do icing or something after ISTM?
No, after ISTM, you can encourage for small stretches. No need to apply the ice. But once you feel you created some serious redness during the application of ISTM, then you must go with IS application. Otherwise, no
So,
need
sir,
for IS
people are
application.
asking about the webinar week link. So, can you send me the link so that I can share with them?
It's available on my Instagram. You can just go to visit my Instagram. You can see some flyers. In that flyers, we just mention the Google link just below the Google Meet more. You can see this Google link, Google Meet link. You can join. Otherwise, you can message me direct message in the Instagram. I will reply with this. Can we use the plantar fasciitis? Yeah, I love to use in plantar fascia. Yeah, you can use it in plantar fascia. It will giving amazing results. I treat numbers of patients with plantar fasciitis, and believe me, within a 2 session, they are rocking. They don't have any pain after 2 sessions. So you can use it for plantar fasciitis. Yeah, good question.
Yeah. Someone has also asked, sir, that can we use this technique for flat foot?
Yeah, flat foot, it's a bony issues, but again, it's pain generated because of the soft tissues. So you can use it. Yeah, you can use it.
What are the sites where this is contraindicated?
Nothing like that. But it depends on the body. Like if you're having a pathological issues, then it's contraindicated. Otherwise, it's everything.
What is the cost of instrument?
What are the costs of the ISTM tool? For this tool, for this all about physiotherapy channel, and for all viewers, it's just 2,500. If you're buying the same tool from Glory Chamni, like international institutes, then they must be charge you around 5,000. So
Yeah.
it's not like that it's Indian made or it's a foreign made, but I love to, I don't want to, क्या बोलते हैं, मैं अपने ही भाई बहनों को लूटना नहीं चाहता फिजियोथेरेपी के भाई बहनों को. That's why we are not taking much money. We just trying to charge you about the manufacturing cost and the labor cost and your cruise services. That's all.
And sir, as this is made up of stainless steel, so it's very good. Like no rust
Yeah,
or
we
something.
have a different ISTM tool. If I'm talking about the international ISTM tool, there it's mostly made up of in the 304 graded of stainless steel. But our tool, specially made it in a 316L. It's a medical grade ISTM tool. So it's the grades of stainless steel is different in the like other companies and our manufacturing sites.
Okay, sir. Thanks for all this information. It was really very helpful. I guess all the students will find this very helpful, and
Yeah,
everyone is
yeah,
you again.
yeah. You know what? I'm very thankful to you because today I attend this my live session. So they must be happy after this my performance on the ISTM because like Gustav is there, Swapnil sir is there, and Rash is there, and maybe my colleagues also are there in the live session. So they must enjoy this. So we can
Yeah.
use. Uh, So we can use in spasm mobile paraspinal. Yeah, for paraspinal spasm, you can use it. For that, you need to do some precise work. So you need to go with some finer edges. Then you can go for release. You need to hold the tool like this and go for lateral stretch of the skin, which will help you release the spasm because lateral stretch of the skin will help you to stimulate the Ruffini endings. And the stimulation of Ruffini endings will have to reduce the spasm on a quick way. So you can use it.
Right.
Okay.
In
Soft
soft tissue,
tissue
you feel
injury.
something is better or ISTM.
I love to go with ISTM, but during the scaling, you can you feel some adhesion on the superficial way. That time you can apply the cups and you can release it. See, cups only can work on the superficial fascia. We have three fascia: superficial, deep, and visceral. For superficial fascia, you can release the adhesion with the cup. You can apply the cups and just try to pull it. It's very easy. For deep, it's not easy with cups because cup can create only a axial traction, not a horizontal work.
Yeah. Thank you, Dr. Jatin, expert and valuable information as always. So everyone is thanking you, sir. So I
Oh,
guess the
thank
questions are also over. Thanks for your time, sir.
Ash, one of my Singapore friend and my mentor, the Dr. Ash, also.
So yeah.
And it's always pleasure for me to be online, and whenever I'm having a session on online, Ash must be there. So I'm very thankful, Dr. Ash, to having enjoying my session.
Good relations, sir, you have built up with all around physios and practitioners all around the world.
Yeah, I have a good relations. I have a good friends, physio friends in like different countries of Asia and the like in US and Brazil everywhere. They are good physiotherapists. Yeah, they respect our Indian physiotherapy a lot. You know what? They believe that Indian physio having a deepest knowledge in physiotherapy. I don't know why Indian people are crazy about the foreign techniques, but believe me, Indian education of physiotherapy is one of the best education, including from basics of physiotherapy, from anatomy to advanced physiotherapy treatment. Everything is available in India. See, in the foreign aspects, they have their what I can say different type of electrotherapy instruments, but we have our different techniques and different principle. You can if you learn about the basic working principle, you can learn you have learned what is pain and how you're going to react on your body, how to relieve that pain. It means everything you know, so no need to use any what I can say funny instrument for that. You can use what I can say. I can explain better way if you're using a shock wave. Then same time you can use the ISTM tool. The ISTM tool give a better result than shockwave therapy. So don't waste about near about 6 to 10 lakhs, between the range of 6 to 10 lakhs for shockwave. Just buy this 2,500 tool and you can get the amazing results.
So, sir, one question is that when we glide this ISTM tool, the heat that is produced above the skin, does that help? Does that give help in that releasing of fascia?
Yeah, it's superficial fascia. It's very easy to release. Yeah, it will help. During my session, I also explained on my IC technique on the thoracic lumbar fascia. When the person has the issue with the forward banding, immediately within a few seconds, I can increase that forward banding with the help of ISTM tool on the superficial fascia. It's very easy for me. Yeah.
Sir, can you give advice to students to how to utilize this time in the lockdown period?
Lockdown period. More or less, I am on the more time. I am on the PUBG, but you people can utilize your time to one of the best thing I want to share with you. Just try to read about the receptors, like microreceptors, will open up more work in a physiotherapy profession. If I'm talking about the TENS, transcutaneous electrical nerve stimulation, so TENS also work on the mechanoreceptors. If I'm talking about the kinesiotap, then kinesiotap also working on your mechanoreceptors. If I'm talking about the ISTM, then ISTM also going to work on our receptors. And if I'm talking about the joint, peripheral joint mobilization, then also in the peripheral joint mobilization, grade 1 and 2, working on the basic on the mechanoreceptors. So everything is rely on your mechanoreceptors. If you're dealing with pain, then you must learn what is mechanoreceptors, how it will help, and how it's going to work. Why you guys think pain is normal? No, pain is not normal at all. But if you have visual analogous score, it's about to 5 scale, 5 grade, then it's normal. It's not more than 5, because if you're giving pain to your soft tissue is going to be contract. तो जो मसल स्पाज्म आप रिलीज करना चाहते हो उससे उल्टा हो जाएगा, वो मसल स्पाज्म बढ़ जाएगा. For that reason, no need to give pain. Can we give this in the patient XRM or SMRS? I didn't understand. SMRS.
No idea. So, sir, yeah.
So,
Yeah.
one message for everyone: never try to give the pain to any patient. So, physiotherapy should be painless, and whenever going to work for soft tissue, the treatment should be on a soft way. No need to apply more aggressive treatment. Soft tissue treatment should be on a soft way, and never just rely on the treatment on the tendon. For tendinitis, just try to also work on the muscle belly, because muscle belly and tendon are both are interconnected. Skeletal muscle relaxation, yeah, you can use it as a you can use it for fibromyalgia. You can use it ISM techniques. Yeah. Can we
So, sir,
give the
can be given on as yeah. So, sir, what all techniques do you perform? Like, what all workshops do you take on what all topics?
for I'm talking I workshops for ISTM, for cupping therapy, for dry needling. Yeah, for these three I'm using. Yeah.
Okay, sir. Fine, sir. So, I guess these questions will never end. Yeah,
It's
students
okay.
are very curious about this, and
Right. So thank you so much, all viewers, and thank you so much all about physiotherapy team that they are working very hard for upliftment of the physiotherapy profession. They are every day they're inviting different instructor from India and outside India. It's the best job. And one of the best thing. It's toughest job to address everyone on their perfect time and need to aware all the participants to come on everything. Sir, Vinezu exam will take, or there's not a platform to answer here. Must be student from my region colleges, so they're asking me about the examinations. So thank you so much, everyone. Thank you so much, Lufran, and give my regards to your whole team. Very soon we will meet again, and we're having a enjoy.
yeah, we'll party soon, sir, after lockdown. Yes, sir.
Lots of yes, 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 yes.
Thanks a lot for your time, sir. We appreciate the things that you do for the upliftment of a profession, physiotherapy, and the webinar week is very interesting. Many students from our page also attended that, and people who are
Yeah,
interested, I will also share it with them.
yeah, yeah. Sure, yeah, sure. Okay, for now, bye bye everyone, and thank you so much, Gufran, and
Thank,
having a good future in the physiotherapy. ऐसा
thank
काम
you.
करते रहो, प्रोफेशन ऊपर आता रहेगा. ठीक है? Thank you, dear.
Thank you, sir. Take care. Bye bye. Have a good day.
Bye bye.
So, hi guys, this was Dr. Jatin Patel, PhD scholar and the principal of Vidyadeep University. The topic today was ISTM concept of soft tissue mobilization. I hope he must have answered all your questions and queries. And I just hope that we will organize more IG lives, more webinars with this with great physical therapists like Jatin sir, a gem of a person. Most welcome. It's a pleasure to do all these things for the physiotherapy field, and I just hope all of you are benefited with this IG live of ours. And yes, tomorrow also I am thanks Jay Joshi, partner, and he is in my team of All About Physiotherapy doing good work with me. So guys, I wanted to tell you is that tomorrow we have one more live with Greg Todd sir, and also he has organized a big platform for physios around the world, which he will be like telling us about that in that IG live. He is from Florida, USA. Thank you, Surbi Rane, for appreciation of my work and my team of All About